Hello everyone, this is Alex from Swoosh English, and in a series of videos that I've been doing recently, I've been addressing some of the common questions that I'm receiving, whether it's on Facebook, Skype, email, etc. And one of them is this kind of celebration where doctors and nurses are like, yes, I don't need to take the IELTS exam anymore, which is an academic exam. I can go ahead and take a medical or healthcare examination, and then with no preparation I can quickly just go through it, take the exam once and then pass. Wrong is the answer, because it is a healthcare centered examination, but it's related to English. So it's an English examination. I should say the other way around. It's an English examination related to and centered on a healthcare context. So a lot of doctors and nurses out there, and maybe you're one of them, are thinking that, well, you can just go ahead, take this examination, it's a healthcare examination, and you can just use healthcare language, just pile in the healthcare language and use as little English as possible. So, you know, you might be using, and of course you'll be familiar with the medical terminology that you're using day in and day out, especially if you're a doctor or nurse that's working in the Middle East, for example, and you're in an English-speaking environment every day in the hospitals that you work in. Most of you out there are in, you know, you're expats in the Middle East, and you're just using this medical terminology, but maybe with your English you're making a lot of bad, you have a lot of bad habits, you're making a lot of errors with your English, but of course no one will correct you in that environment with the, you know, especially with the speaking side of things where you're speaking to patients and colleagues, etc. So it's really important to understand that this is an English examination. So your use of English it's all about impressing the examiner, and the examiner is assessing you on your English ability, your command of English, whether it's the speaking side, the written side, of course, with understanding the text in the reading and what you're listening to in the listening examination. So it's really, really important that you don't underestimate this examination. You manage your expectations and you get the adequate preparation that you need. A good example of the fact that this is an English examination is in the OET speaking role plays, the 2 role plays that you need to undertake. The interlocutor, which is the person who plays the role of the patient, is not your examiner, okay? You're doing a role play where there's yourself, there's the interlocutor who is the patient, and then you've got the examiner who is watching and of course is assessing you. And then those recordings are sent to Australia or sent to Melbourne for them to be marked. But that interlocutor, and this is a key question we're getting many times, that person is not a medical professional. The interlocutor who plays the patient is actually usually an English teacher. So they won't have the medical terminology, the medical jargon that you have. So some of the questions that they ask will be legitimate questions. They don't know what certain words mean, you know, with the way that you read, you know, with the way you use the terminology, etc. You need to be making sure that you're not, I suppose the word is, you're not blocking out, or you're not not underestimating, but you're using the right terminology for the kind of person that you're dealing with. So of course you're not going to use overly complicated jargon and terminology with a patient. Okay, so you need to remember that this interlocutor is playing the role of a patient who doesn't understand maybe the terminology that you have. So I just wanted to use a quick example to say that this is an English examination. I don't want any of you to misunderstand this whatsoever. So, and the other thing I want to mention as well, another example of the fact that this is an English examination, is the fact that you have 5 criteria for writing. And I'll go through these in a separate video, but those 5 criteria, things like overall task fulfillment, you know, did you complete the task set, your presentation features, things like spelling and punctuation. These again are critical foundational English skills that you need to impress the examiner with your command of English. Again, things like appropriateness of language, using the correct language for the context that is given within the task. So that is a quick video today, just to make you all aware that it is your English ability that you are being assessed on, and not necessarily, you know, your medical terminology, the medical language, and just kind of stuffing and packing in as much medical language that you get from the case notes. It's not the case of just going through those case notes and grabbing as many medical words as possible that you know that you're working with day in and day out. It is your English ability, things like with the cohesion side of the 5 criteria, where you'll be assessed on your linking words, using words like however and lots of other words just to connect your ideas and bring them together. So thank you very much, everyone. If you have a question about anything I've spoken about today, please feel free to put it in the message box, and I look forward to helping you with your OET very, very soon.